Hello and welcome to this MD Newsline podcast on recognizing the red flag symptom clusters and common misdiagnoses of systemic mastocytosis. I'm here with some amazing panelists. Can you please introduce yourself to the audience, starting with you, Dr. Siri?
Great. My name is Dareen Siri. I'm an allergist immunologist, and I serve Central Illinois. I have a private practice. I'm also affiliated with the university here in the middle of Illinois. I'm really grateful to be here to talk about systemic mastocytosis. It's not really well recognized, but more recognized. So I appreciate the fact that you're doing this today.
Wonderful. How about you, Jessica?
Sure. My name is Jessica Fraser. I'm the executive director of the Mast Cell Disease Society. We are a patient advocacy organization that supports patients and their caregivers and also clinicians and researchers who are working in the field of mast cell diseases, including systemic mastocytosis.
Okay, wonderful. Starting with you, Dr. Siri, can you please just give us a basic definition of what systemic mastocytosis is?
Yes, systemic mastocytosis can be quite challenging. It has a lot of symptoms that arise, and some of these symptoms seem like that they could be rather variable. They're sometimes hard to recognize, and so putting it all together can be challenging. But typically, most people have some kind of skin manifestation that could be flushing, that could be hives, that could be itching. Some people also have cardiovascular manifestations, which may include things such as that looks like anaphylaxis, dizziness, actually feeling like there's an allergic reaction and then getting dizzy and then potentially even losing consciousness. They may actually even have low blood pressure. Some of the patients may also have feelings that their heart is racing periodically. And then another organ that may be involved is gastrointestinal. That could be something like diarrhea, abdominal pain, nausea. They may feel like they have food allergies for the first time or intolerance to certain foods or medications or other things, or sometimes even without necessarily a trigger with something ingested. And also, some people also have things that look like fatigue or bone pain or these other symptoms that are a little bit more nebulous, such as brain fog. So those kind of nebulous symptoms, the skin symptoms, the GI symptoms, the cardiovascular symptoms, and then something that seems like they're intolerant or allergic are all the different kind of systems that we commonly see with something that represents systemic mastocytosis. Ultimately, what that means is that there's this cool, maybe not so cool to you, immune cell called the mast cell that is overproduced, and it invades different tissues and organs in our body and releases a bunch of chemicals. And that is why we are feeling these different symptoms. And that's why patients can have such variability in their symptoms, because it just depends on where these masses are hanging out and what makes them trigger in order to release the chemicals. And that's also why it's sometimes variable, which means that sometimes you're like, hey, that banana really caused me to flush. And sometimes that banana did not. Those kind of things. So hopefully that encapsulates kind of roughly what systemic mastocytosis is.
Wonderful. And Jessica, in your experience, what early symptoms or complaints are most often reported as being dismissed or misunderstood from the people you work with?
So as Dr. Siri was just mentioning, it can be so variable. So it really is hard to choose like one or two early symptoms because it is very, heterogeneous. As we say, there's so many different ways it can present. And so it really is different for each patient. I would say if I had to pick, I would say that skin involvement of either itching, flushing, hives is very common. And then also diarrhea. And diarrhea can be really challenging because there's so many different things it could be. You could have a touch of food poisoning. You could have, a food that doesn't agree with you. You can have a myriad of other GI complaints on top of it. So we're really like looking for that multisystem involvement to figure it out. But it can be very confusing to patients when, as Dr. Siri was giving an example, they have a banana today and they flush. They have a banana tomorrow and nothing happens. They have a banana 2 days from now and they have diarrhea. Like, what does that mean? So it can be very confusing for both patients and clinicians, I imagine. That Dr. Siri would have to speak to that.
And what red flags would prompt the clinician to start considering mastocytosis earlier on in the diagnosis process? Because we talked about, it presents as food allergies, presents as so many things. How do we begin to narrow it down, Dr. Siri?
Yes, it takes a little while to get diagnosed because these symptoms, which are multisystem, multi-organ, have to be put together. I think that the biggest potential for patients and for physicians is that, number one, if they go to an allergist or a primary care doctor and then they have all these allergic symptoms, but then they test negative to allergies, I think that's the first clue. Like, wait a minute, you're telling me that you have all these strange allergic type symptoms to a food, a trigger, a chemical, a perfume, things that we don't normally think of as necessarily triggering allergies. Yet when I test you, your blood work seems normal. You don't have eosinophils. Your IgE is not elevated. We skin test you and there's no allergies. We blood test you for allergens and there's no allergies. I think that is probably the first clue that these symptoms are either out of proportion, more exaggerated, or that they don't really fit the clinical picture. And so I think that is the biggest first clue. And even in my practice, we've discovered systemic mastocytosis patients when we've been treating them for allergies for years because, of course, allergies are common. It's up to 40% of Americans between pediatric and adults. So someone likely going to have an allergy. And we've been treating with patients and they were getting allergy shots and maybe they were being treated for asthma and maybe they developed some new symptoms. And we're like, wait a minute, why are you having so many problems? And then finally we think, let's check for systemic mastocytosis or mastocytosis. So I think that even in an allergy practice that treats a lot of patients like this, you can be tricked. And I think that those kind of vague symptoms, food intolerance, idiopathic anaphylaxis, chronic hives or flushing, anxiety disorder, irritable bowel, these kind of things, if we put them together and ask about the whole patient, which often allergists and immunologists do, then we might come to this understanding that maybe we should check for systemic mastocytosis.